Medicare options. You bet your life. When you reach the age of 65, you have the one-time chance to make some basic decisions that will probably stay with you as long as you live. This video is to assist you in making overall planning. At the end of this video, however, I have left you some sources that you can contact personally, generally at no cost, and find out specific answers. What are the options that we have to deal with? Number one, regular Medicare, heavily regulated, run by Social Security Administration. All ads must conform to a certain criteria. Prices must be available. If you have a reason to make a complaint, you have a place to go. Normal Medicare pays 80% of your out-of-pocket cost when you go to the hospital or have some sort of test done. The patient normally would pay 20%. However, by pairing that with a Medicare supplement policy, you can cover the 20% for about $150 a month. You still have to have a drug or prescription policy. It's another from $0 to $50 a month. But in 2025, the most you're going to be out of pocket for drug coverage is $2,000. You also have the option of going with what's called a Medicare Advantage plan. An Advantage plan is really not always an advantage, but it's a private insurance company who has set up a contract between them and the U.S. government. And out of that, they have to pay for the total cost of your health care for a period of time, normally the year. Medical services under Part B are never free because they are, regardless of which choice you make, Medicare will deduct in 2025 $185 a month to cover a basic portion of the cost. You will then have your obligation to decide how you're going to go from there. Normally, what's called a Medicare Advantage plan, again, a private insurance company is doing this, and they have the rights to delay or refuse treatment. Now, normally, refusals are still overruled about 96% of the time, but they can deny you the right to proceed with a particular treatment. Depending on where you live, your Medicare prescription policy may be available at no or little cost. Each prescription program has a list of drugs that they cover and that they will pay for up to their obligation, and there may be a little or no cost. What the list of drugs is called a formulary, and if your drug is on the formulary, they will deal with paying for their share of the cost. You still may have some copays or additional costs involved. Based upon your particular formulary, there's still some other things that you have to be careful of that you have to check. The way you do that is you go at the end of the year, you have the ability to go to Medicare.gov and talk to one of their representatives, and they will tell you to the penny what your cost is going to be for the various options that you're asking them about. A healthy 65-year-old person who comes into the Medicare situation looks at the fact that they can get their Advantage plan for little or no premium and say, that's for me. I go to the gym 3 times a week. I walk 5 miles a day, or whatever the deal is. I'm perfectly healthy. I'm never going to get sick. So therefore, I like the idea of no premium. So my healthcare costs, as long as I'm healthy, are zero. However, at some point in time, as we age, our healthcare, our health concerns grow, and our ability to deal with them get less and less, requiring perhaps hospitalization, perhaps extreme numbers and amounts of tests that may be somewhat or all not covered by your Advantage plan. It is also possible that they may cover, for instance, one procedure a year of a particular test, but not anymore. I had a friend who, because of the fact that he didn't have the money to pay for the second test, lost his life because he couldn't afford to go to the hospital and pay the extra $500 or whatever it was for the second test. The supplemental plans do not require any permission. You can go to any hospital that accepts Medicare assignments and get treated immediately if they will admit you, and your cost should be covered less any possible. There's sometimes some deductibles on that, but not very much. And so as a result of that, 10 years ago, I went to MD Anderson because my dermatologist said I had skin cancer, melanoma, stage 4, which means it had spread to other parts of the body besides the place where it started. I had no reason to think that anything good was going to happen because the admitting doctor, even at MD Anderson, the best hospital for cancer in the United States and perhaps the world, told me that I had 6 to 9 months to live, and that probably there was nothing else they could do for me. If they couldn't remove the stuff surgically, I was just out of luck. However, because I had a supplemental policy which guaranteed payment for all of my hospital costs and hospital administered treatments, such as chemo, I was able to be admitted, to get set up for a new drug that had just come out within just a matter of a few weeks or months that might have an effect on my melanoma, on my scalp, and it might not. But at least I had the option and I had the money to get it. That medication, because it was brand new, I have no idea what the cost would be. But I was administered numerous doses of that medication. I then had to have some pills that would follow up with that. And as time went by, the cancer shrunk. Part of the reason, in my mind at least, is that I got there early and I got it taken care of before it had grown to a mass that I couldn't deal with. Otherwise, 6 to 9 month lifespan is not very long. So I had to give that a lot of thought, but thank goodness I had chosen a supplemental policy, and I had to use a Medicare Advantage plan with a gatekeeper. The first thing the doctor in charge would have probably said was, "Are there any cheaper options?" Well, no, there weren't. Numerous people told me of stories of people who died from melanoma cancer in about 6 to 9 months. So I knew this was something that was real. I had to make that choice to go ahead and proceed with that treatment. But had I not had that supplemental plan, I probably might not be here today. So that's why it's so personal to me. If you have a gatekeeper that has to say, well, we have another medication that we think might work. MD Anderson is the best cancer hospital in the world. Their doctors see thousands of patients a year, hundreds a day. And if they don't think that something's going to work and they offer you something other, a new medication, they probably helped develop that medication. They may have even done the clinical trials on that medication. And rather than rely on someone who may not have seen a cancer patient but maybe once a month in an Advantage Plan situation, my doctors are seeing people by the thousands every year. And when they tell me to get a certain drug, if I can, I want to get it. And I want to get it now, not 6 months from now when they've decided, well, none of these other things worked, so go ahead and get them the medicine for the new treatments. But it may be too late. So that's my story. And I will assure you that it is, again, a very personal thing to me, because had I not been able to use that medication, I might not be here. There are 3 places that I would recommend that you might want to go to get some additional information. And again, 2 of these are absolutely free. The third one is free, but you can get a personal consult with a very well-informed person who knows all the ins and outs of the Medicare system and health and the Social Security system too, just in case you need some more information on that. Here's what they are. Number 1, Medicare.gov, run by the United States government, always free, always easy to get through to. They can tell you specific information about specific problems that you have, and they will stay on the phone with you until you get the questions answered. And that's very important to you, because sometimes you don't know what to ask. And they will generally be able to assist you in asking the right questions and then giving you the right answers. There are 2 YouTube channels that I subscribe to that I think are well managed and are absolutely authoritative as far as giving you the correct Medicare information. There's a lot of people with opinions about how you should do this or that. But when you talk to someone that does this all the time, and that's how they make their living, or in one person's case, the way they do their retirement as a mission to help others who don't know how to deal with these problems, I think that's very important. So you might get on YouTube, and there's a gentleman whose name is Dr. Ed Weir, PhD. He is a former manager of a large Social Security office, and he has handled thousands of cases over the years, and he can advise you specifically on your case. If you have a particular problem or you desire to get absolute confirmation, he will do an online consult with you for a fee, a small fee of around $100 or something like that. That sounds horrible to have to pay for that, but you don't have to pay for it. But if you want specific information, sometimes getting a complete diagnosis of your situation is worth $100, and it may save you thousands of dollars. The other source is a place called on YouTube called Medicare College. This is actually an insurance sales organization that covers healthcare for seniors. Who makes the presentations on the information he's giving out is very complete and very thorough. And I always listen fast, but get my answer from him. But if sometimes you want someone that will take their time with you, again, you may go back to Dr. Ed Weir. He is on YouTube at least daily, sometimes 2 or 3 times a day, at least once a year between October the 15th and December the 7th. You need to check with Medicare.gov, give them a list of your medications, and ask them to find you the best policy for the medications. Also, if you have other questions, you may need to ask them. They can assist you in finding the answers. This video explains what I call the second tier of the all-red aging pyramid life cycle. The next video will cover housing and alternative living as a solo or a couple, which will involve living with relatives, assisted living, nursing homes, and any other options that might be available. This is Mac Allred, CPA, retired. Us old folks.